Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Lilia Simic, also with the Department of Communication. Today will be one of the best episodes you will ever see as we talk about LASIK, including what it is and whether it's right for you.
All right, let's dive right into this conversation. Today, we're joined by two Michigan medicine experts. First, can the two of you introduce yourselves, explain your roles in the organization, and then to start us off with some fun, tell everyone what you're most looking forward to this summer.
Sounds good. My name is Shazad Mian. I am a cornea specialist at Kellogg Eye Center, and I'm a faculty member in the Department of Ophthalmology and Visual Sciences, where I've been for faculty for 24 years. I also serve as the chair of the Department of Ophthalmology and as the director for the Kellogg Eye Center. Today is a nice warm day, and we're excited that summer is hopefully finally here. And one of my favorite things in the summer is to have at least one trip up north. Michigan is such a beautiful state, and having the opportunity to go visit Traverse City or Mackinac Island is always a treat. So I always look forward to having at least a weekend or two up north.
My name is Chris Hood. I'm one of the other cornea specialists on faculty at University of Michigan Kellogg Eye Center. I've been on faculty for about 15 years, and I also serve as the medical director of the Cornea and Refractive Surgery Clinic. I love summer, one of my favorite seasons of the year, and like Dr. Mia, I'm looking forward to getting outside. I enjoy little mini trips to on our boat on weekends, and getting outside, being on there. It's like a little mini up north trip. Almost every weekend I can get on the boat. So I'm looking forward to that with my family and friends this summer.
Okay, let's start broadly. When people hear LASIK, it can sound intimidating. In plain language, what happens during the procedure and how long does it take?
Great question. It is common for people to be intimidated by surgical procedures like LASIK, but it's a really simple procedure. The main goal here that we have with LASIK is to help reshape the cornea, the front part of the eye, to allow light to focus and allow people to see better, similar to what their glasses or contact lenses are doing for them.
And there's kind of two or three different types of refractive surgery, two corneal-based main ones that we offer at Kellogg. LASIK is the one that most people think of. And in LASIK, we actually create a flap in the cornea with a laser. We then lift that flap very gently, and we can reshape the cornea underneath it with a different laser to achieve that prescription by reshaping the cornea. And like Dr. Mian said, to help light focus onto the retina. And then we put the flap back down. And it's an amazingly fast procedure. The actual procedure generally takes only about 20 to 30 minutes. The actual lasering part of that is even more brief. The actual lasering is just a minute or two of that total time. But like a lot of things, the preparation is the key. Getting an accurate prescription and talking about expectations and doing the kind of pre-work is a lot of what it takes. The actual surgical procedure is the briefest part of this whole process in many cases.
Science is amazing. Can you talk a little bit about how reshaping the cornea actually helps you see better?
Sure. How we normally see in our eyes is that the front part of the eye, the cornea and the lens help focus the light onto the retina. And that's how images are formed and sent to our brain to be able to see. It's very much so like if you're old enough to have had regular cameras before digital cameras where the lens focuses the light, forms the image on the film, and the film is processing the image for us to be able to see clearly. And when somebody is nearsighted or farsighted or has astigmatism, the light is not focused properly, and as it's going into the eye, and the image that forms and going to the brain is blurry. So what we do is we use glasses or contact lenses to be able to form that image more clearly and see. And surgery can do the same. We can, at a very micron precision level, reshape the cornea to be able to allow that image to actually form on the retina so we can see clearly, whether we're trying to see better far away or close up. It can do all of that.
Yeah, just to clarify that again, it's really a shape issue. So when light rays are not focused onto the retina, it's sort of a shape issue, and we can reshape the cornea to then get those light rays to focus onto the retina, and that's what's going to give us clarity of vision.
People often ask, is LASIK even an option for me? So what typically makes someone a good candidate?
Well, that's one of the most important questions that we get all the time. And it's very pertinent because it is hard for people to know if they're good candidates or not. And it can really help everybody make a good decision about whether they should be evaluated or consider surgery. And one of the most important things to know whether you're a candidate for LASIK or any kind of refractive surgery is that you have a stable prescription. If you wear glasses or contact lenses, if your prescription is not changing a whole lot, that helps us determine whether you have a good enough prescription to be able to be corrected predictably with surgery. Of course, it's also important to make sure your eye exam, your eyes are healthy, and there are other specific things we look for, such as the cornea, the front part of the eyes being thick enough. Those are important things to consider. Now, there are things that we also know make somebody not a great candidate for surgery if they have severe dry eyes or they have other eye conditions such as keratoconus, where the shape of the cornea is irregular, or other issues that impact healing of the eye. So those are some of the common things that I think people can think about or look at to consider whether they're good candidates for surgery.
Okay, so let's say you are a good candidate for surgery. It is surgery, like you've mentioned and talked about. What sort of will the day of look like for a patient? What should they expect?
So people are generally around the clinic for about an hour or so on the day of their procedure. It is a clinic-based procedure, so it's not, at least corneal refractive surgery, we can talk about a non-corneal based one later, are done in the clinic. And so we have our lasers right in the clinic space, in the cornea clinic. And so we do these in our clinic space, and people are there for, like I said, about an hour. The actual time in the room is about 30 minutes, but the actual lasering is only a very brief part of that. Most of the time, like I said, is just getting people set up, creating a sterile environment to do the actual laser work. So people can expect that they come in with a companion, with a driver, because they're not going to be able to drive that day. They get their procedure completed. We talk about expectations afterwards and what they should be doing in terms of getting their eye to heal. And then the next follow-up will either be the next day or the next week, depending on the type of surgery that they have. And most people can walk out. They usually feel okay at that point, depending on the type of procedure, whether it's LASIK or PRK. They may have a little bit of eye discomfort or pain later that day. Most people can walk out without any issues. I should mention that we give them a Valium pill if they want to before the procedure, just to take the edge off. People are awake for these procedures, which obviously sounds scary, but we can get people relaxed with a little Valium pill, and we can coach people through it. Almost all people, especially these people that are contact lens wearers, are used to the idea of people, the idea of touching around the eye, and we can talk people through this without too much difficulty.
One of the things that we often get asked is if they're going to have pain during the procedure, but we are able to numb the eyes up with eye drops, and it's actually really pain-free throughout the procedure. There are components where you might feel a little bit of pressure, but it's really more of a light show. And some people sort of describe it as a psychedelic experience because they're seeing all these lights swirling around during the procedure, even though it's relatively short. So it is well tolerated because we're able to numb up the eye appropriately and keep people relaxed with medications, and more importantly, talking them through it. And especially given that it's a short procedure with even shorter periods of time where we're actually doing anything. A lot of it is sort of staging one step to the next step.
Yeah, I would say almost universally, people think it's easier than they thought it was going to be after they go through the experience.
So recovery is often a big question, and you've both mentioned it a bit. What do the first 2 days, first couple days look like? And then when can people start getting back into their normal routines of driving, going to work, all of that?
Great question. So in general, with LASIK, when we are creating the flap, the recovery is actually fairly quick. There's still pain, light sensitivity, scratchy feeling for about 4 to 6 hours. So we generally recommend people go home and take a nap, take some ibuprofen or Tylenol, keep the room dark, and go to sleep. After about 4 to 6 hours, they generally feel much better. There might be still a little bit of haze, but they can function and really do most tasks even early on the day of. It does take a few days for the haze to lift up. You do have to use eye drops, including day of the procedure, to help reduce risk of infection and minimize inflammation after the procedure. And we do recommend that you are very careful in not touching or rubbing your eyes, because the eye is fresh and you can cause an injury to the eye if you accidentally rub your eye. So we do recommend wearing clear shields over the eyes that we put on at the end of the procedure, especially at nighttime, but even when you're out and about, good to wear at least sunglasses as a reminder for protection of your eyes. Now, for patients who undergo PRK, the other common laser corneal surgery procedure we do, it does take a little bit longer. The first 3 to 4 days, the eyes are painful, light sensitive, irritated. After 4 or 5 days, the pain's all gone, the vision's better, but it takes a few weeks for it to fully settle in. Even at the end of the first week, most people are back to work and doing what they need to, but it's not completely clear. It takes a few more weeks of fine tuning for the vision to stabilize.
Yeah, I would say that most of our LASIK patients, we see them the next day. We all see them all the next day. Most of them are able to, after they're seen, drive home from that appointment if they are comfortable with their vision at that point, and almost everybody is. Most of them can resume their normal work activities unless they have a very visually demanding job almost the next day. So there's very little time off of work for LASIK. PRK, as Dr. Meehan mentioned, is a little bit longer recovery. And those details, whether you're a candidate for LASIK versus PRK, and the risks and benefits of both of those would be discussed based on your individual, eye situation at the time of your appointment.
So some people may have heard of ICLs too as an alternative option. What is the difference between that and LASIK? Can you tell us a little bit about that?
Sure. ICL stands for intraocular contact lens, or the official name of it is intraocular Collamer lens. So this is a lens implant that's going inside the eye. It's kind of like wearing a contact lens, but it's being fit inside the eye. These have become much more readily available and are a good option, especially for people if they're not good candidates for LASIK or PRK. And that's generally how we utilize them in our practice, although the range overlaps with people who are candidates for LASIK and PRK. It is indicated for people who are nearsighted and have some astigmatism, but especially people who are very nearsighted, that have high degrees of nearsightedness, that are not easily correctable or have higher rates of complications associated with LASIK or PRK. So we tend to use these as an option for people who are not good candidates for LASIK or PRK, or who are looking for alternative options. One of the other advantages with this procedure is that it is technically reversible. You're putting the lens in and you can remove it if you have to, if the outcome is not exactly what we want it to be.
And just to add that this is a different procedure in the sense that it's also done in the operating room as opposed to in our clinics. So it's a little bit of a different process done in the operating room. And a small incision is made to get into the eye to put this implantable lens into the front part of the eye. So it's not so-called corneal-based refractive surgery. We're not reshaping like we are with LASIK and PRK. We're actually putting a removable lens into the eye.
What's one common myth or misunderstanding about LASIK that you commonly hear? Something you wish people knew before ruling out both surgeries?
Yeah, I would say most people are quite well informed, honestly, when they come to our clinic. I mean, there's so much information available. But I'd say two things I still hear occasionally are that we can't treat astigmatism, which we certainly can, and that LASIK only lasts a certain amount of time. That I'm only going to be able to see for 5 or 10 years, and then it's going to wear off. There's no necessarily wearing off of a LASIK effect. If the prescription is actively changing, it's important that we have stability of prescription, but if there is some small change that occurs, we're only treating one point in time. So that's one reason people can have wearing off, but that's certainly not expected in every patient. And there's a rare thing of what we call regression, which there can be in more commonly highly nearsighted people, a risk for the prescription changing a little bit over time. But there's no 5 or 10 years with LASIK effect is gone. Some people have that myth. And like I said, astigmatism, which is just curvature of the cornea with a directionality to it, is treatable in most cases with LASIK or PRK and ICL as well.
Yeah, and we also find that people also think sometimes that they're not candidates for any procedure if they cannot have LASIK. So as we've already discussed today, that there are other options for people who are not good candidates for LASIK or like PRK or ICL. So we have more options than we've ever had before to allow people to have their vision corrected and be independent of glasses or contact lenses after surgery. Another, I think, myth that people sort of think about, or at least ask us often about, is how they will keep their eyes still during the procedure. And one of the things that it's important to remember is that, again, the steps are short when we're doing the laser, and it's controlled. The lasers actually have tracking systems that track your eye movement and move the treatment if your eye moves a little bit, and certainly will shut down if you move too much. Not that it's a big issue, but the eye movement issue is actually controlled with many different levels of careful technology that we use.
I'd also add one last thing is that people sometimes think that age is an excluding factor for refractive surgery. It really isn't. There's certain things to consider when people are older, 45 or older. Generally, you have a need for reading glasses, and that can change the conversation about having LASIK or PRK or ICL. But you're not excluded from being a candidate if you're 50 or even older than that in some cases. So I wouldn't let age necessarily be a rule out factor, although many people are younger than that. We do it on people who are older as well with good outcomes.
I love it. And I think for the second time today, I'm now going to say science is amazing. That note about the lasers and how they'll keep up with your eye movement, just really, really cool to hear about that. All right. So hopefully we've convinced some people that they are good candidates for LASIK, or it's something that they should consider. Let's say though they're still on the fence. Are there sort of any easy first steps or pressure-free steps that they can take just to learn even a little bit more about this and decide whether or not it's something they should move forward with?
Sure. And the easiest thing to do is have a consultation or an exam. We highly recommend that if you are on the fence or you don't know enough about your history and have questions, you can have a thorough eye exam to be evaluated to see whether you're a candidate for surgery. And as part of our evaluation process, we do a number of tests to make sure that number one, that the procedure is safe for you and that the results are going to be as predictable as they can be. It may turn out that you're not a candidate for surgery, but at least then you know for sure whether you're a good candidate or not. So a good eye exam to test for all the things that we want to look for is really helpful in making the decisions for next steps.
Yeah, I would completely agree. We do have an email, and we're happy to answer email questions, but really a lot of this needs to be determined for individual situations by actually seeing people in the office and talking about it. And people get over that big hump of making an appointment and coming in, and oftentimes they're surprised that they are a candidate or sometimes not, but at least then they know all the information. And again, you get a complete eye exam. We dilate the eyes, and we look at the eye from front to back with multiple different types of scans. And we'll talk about the options for you as an individual patient and also in terms of expectations and what we could achieve.
Cost is often a deciding factor, but I know there's good news for employees. Can you speak to the employee discount pricing and the difference that can make?
Sure. Of course, cost is always an issue. We do have a number of programs that are available for University of Michigan employees, starting with a discount per eye. So we offer a $200 per eye discount for savings of $400 total for LASIK or PRK. But there are also a number of other options that are available too. We have a payroll deduction where you can deduct monthly from your paycheck up to 2 years to pay for the procedure. Of course, you can also use flex spending accounts. We also have a 0% interest availability through the Michigan Credit Union. And we do have discount pricing available as a training institution if you choose to have our trainees do the procedure. So we have advanced learners like cornea fellows, and we have residents who are always training with us. These are very controlled teaching opportunities and learning opportunities. The procedures are done with us, like Chris and I are there supervising all aspects of it and can control it. But this allows people to have discounts as much as 50% off of the cost of the procedure.
I think, Dr. Meehan, I think you stole a little bit of my thunder. I was going to ask, can you use like FSA and HSA accounts? And I know you sort of touched on that a little bit, but I assume that would be an option, right?
Yes, it's definitely an option, and we do have many people who take advantage of that. It allows you to have pre-tax dollars to pay for procedures like LASIK or PRK. Of course, if you're an employee at University of Michigan, we know that that's common and people do that. But if there are people who are employed elsewhere, you have to just ask your employer what their rules are related to flexible spending accounts and healthcare spending accounts. But University of Michigan does certainly allow for that. And we have lots of people who choose to do that. So they'll put money in October, and by January 2nd, they're ready to have their procedure. And they will, of course, to have that deducted over the course of the year.
Yeah, just another plug for our excellent trainees. A great opportunity, like Dr. Meehan said, to get a discounted price for the procedure. And very supervised by one of our cornea faculty members who are very used to staffing residents and fellows during these surgeries, and we're there through the whole process, seeing patients preoperatively as well as postoperatively. And our outcomes actually are very excellent. They're basically equivalent to the faculty type of outcomes. So for the right person, that can be a great way to reduce their cost.
We monitor the outcomes, and we have published them before as well to demonstrate as an academic institution that the outcomes are equivalent.
Finally, for those looking for flexibility, like you mentioned a little bit earlier, what financing options are available, including the partnership with University of Michigan Credit Union?
Well, we can't emphasize enough that these are really great options that are available. So the University of Michigan Credit Union does allow, we have a program with them that you can get 0% financing for 12 months for the procedures. So that certainly makes the cost a little bit more manageable. Like I said, you can do payroll deduction as well, up to 2 years, which there's a minimal fee. It's less than $1 per month kind of fee that you have to pay to do that. And of course, the flex spending accounts are certainly another good option as well. And all of these options do include the discount that we provide for all employees or additional discounts that are available if there are trainees who are doing the procedures.
I love it. Thank you so much, Dr. Mee and Dr. Hood, for sharing so much of this information about LASIK, whether it's right for you, and then some of the perks we get as employees of Michigan Medicine, and how we can use that, take advantage of your services right through where we work. So thank you so much. If you want to learn more about LASIK and the employee discount available, go to mmheadlines.org. That's mmheadlines.org.
And if you liked what you heard today, be sure to check out all previous episodes of The Wrap. You can find them on your favorite podcast hosting platform, on Michigan Medicine Headlines, and on the Michigan Medicine YouTube channel.
That's all we have for today. Thank you again to both of our guests for joining us. And thanks, as always, to our listeners and viewers for everything you do for patients, families, and each other. We'll see you next time.